Welcome everybody. We're going to go ahead and begin, and excited to share some good information with you about Utah's medical cannabis program. And I'll be presenting the first hour. My name is Rich Oborn. I'm director for the Center for Medical Cannabis at the Utah Department of Health and Human Services. And excited to be here. We've been coming a few years and excited to come. I think this is the third year when we've had a session dedicated to this, and so we're excited to share some information. Immediately after the hour that I'm presenting, Dr. Mark Babbitts will be presenting, and he'll be focusing on some of the clinical aspects of medical cannabis and the endocannabinoid system, and he'll be prepared to share information regarding that expertise that he has as a clinician that treats individuals in cases at times when they might be able to benefit from medical cannabis. And he also used to work at the Department of Health and Human Services, was deputy director, and is my former boss. So, but was a good one. So it's not intimidating that he's here. So anyway, I'm glad to be able to spend an hour with you here. So we'll begin, and also, as we go through slides, you're welcome to ask questions. If there's one that I think we're covering later on, I'll indicate that, but otherwise, you're welcome to ask questions as we get through the material. And then I believe, Mark, if you'll help me at 2:50, let's make sure I stop and we just open it up for any law questions. I think that might be helpful. 320. Oh, yeah. Yes, because we've got, 320. Great. Thanks. Okay. So one thing that is important for us to ensure that we share as I begin is that this presentation, it'll highlight parts of the Utah medical cannabis law, and it provides information that is current as of this date. What's happened is that over time, lawmakers have modified the laws, and we want to make sure that we adjust things according to those modifications. And so what you're hearing today you're going to hear some things that changed just in March of 2023 during the legislative session. And some of those items became effective just on May 3rd, earlier this month. So I'll make sure I touch on and draw your attention to those items, but it could be that lawmakers make additional changes in the future, so obviously the information that I shared today is not going to include those things. Also, I'm not intending to cover all laws related to medical cannabis because we don't have that time, but if you're interested, you're welcome to follow up with our office at contact information that'll be available later in the presentation. And you're also welcome to visit the legislature's website and take a look at things there as well. And then I emphasize also always that what I'm sharing today is not legal advice, and it shouldn't be used as legal advice, so that just covers some disclaimers. Okay, so here's just a review of some of the objectives, and there will be a test that will be distributed at the end of this, at the end of both presentations that you'll be able to complete, and then after that get the CME that you've been coming for. So this just covers some of the things that we'll actually be covering in the exam, and it sets forth why I'm here, what I hope you can understand after we finish today. Okay. Our mission at the Center for Medical Cannabis is always to ensure that qualifying patients are guided by trained medical professionals to receive access to safe and effective medical cannabis products. So whatever we do, we hope to contribute to that mission. This gives you the landscape of what the distribution system looks like in Utah's medical cannabis program. So at the top there, you'll notice that there is 8 cultivators licensed in the state of Utah. If you don't know this already, medical cannabis with more than 0.3% of THC is still federally illegal throughout the United States. But medical cannabis programs have surfaced throughout the United States. There's many of them throughout the U.S., obviously, and we're one of those. And in these programs, under state law, individuals are able to purchase medical cannabis legally. Companies are able to grow medical cannabis legally. And there are only 8 cultivators in the state of Utah that are able to grow it legally. Okay? And one of the critical aspects of that is that it cannot cross state lines because of the federal law. So every product that is legally purchased in the state of Utah is also legally cultivated and processed by state licensed processors and cultivators. Okay? And there's about 15 processors that are responsible for manufacturing the products into different forms. And then there's a unique component about our program is that we have what we call a reference lab at the Utah Department of Agriculture and Food that conducts independent testing on the actual products that patients are able to purchase legally under state law. And that makes us unique because most other states do not have a reference lab that does that. Most other states license labs, but they don't have a state reference lab that is not biased. One thing that has been a major concern across the United States is that the medical cannabis companies or recreational cannabis companies have noticed that patients buy high THC products. Unfortunately, I think that's a focus that they have, right? So they like to inflate the level of THC found in the products, and if they're in cahoots with a independent laboratory that runs the tests, then you've got a little problem of a conflict of interest, and you've got inflated levels of certain ingredients like cannabinoids that they know patients are seeking high levels of, okay, with THC. So in Utah, we have a lab that ensures that the independent testing labs are honest and that the companies are honest about what they are reflecting in what's called the certificates of analysis in Utah and other states, which is what's truly in the product and at what level. What are the ingredients at a very deep level? That's the purpose of that. So how does it get to patients? There's 15 medical cannabis pharmacies located throughout the state, one of which is here in Ogden, called the Flower Shop. And there's also one in Logan and Brigham City and West Bountiful. Those are some of the main locations here in northern Utah. And so an individual can physically go to one of those locations if they're a medical cannabis card holder, and they can go and purchase that product, or they can order online a product. Now, there's only certain, not all 15 medical cannabis pharmacies sell products online and deliver them to a person's home. So there's some limitations in that. Not as, some people would say, not as good as selection or variety of products are available online, but that availability does exist in the state of Utah. Some states don't allow it, but we do. So there's the way, a second way to get it, which is through a courier. And in those cases, those are delivered to a medical cannabis card holder's home. And either them or a authorized caregiver or a parent or guardian card holder has to be the individual accepting that product when they get it. Okay? So that gives you a snapshot of the distribution system in the state of Utah currently. And there are approximately 70,000 active medical cannabis card holders in the state of Utah today. Approximately 850 medical providers participating in the program. We'll give you a little bit more information about that later, but that gives you some context.
Did you say 7 or 7?
70,000 medical cannabis card holders throughout the state of Utah. Yeah. in the state of Utah alone, right? Medical providers that are registered with the Department of Health and Human Services, there's approximately 850, right? Yep.
And I believe the 70,000 is a smaller number than was anticipated, is that correct?
At this time in the program, I think it's more than what we anticipated. We knew that over time things would grow as population grows and people have different approaches about medical cannabis, after a few years after the program was grown, and so we expected that there would be, some initial reluctance, and then people over time would feel not as concerned about it, and that is that factor I think is true. Over time, individuals aren't as concerned about it as they were at the beginning, but as a public health agency, we still want to send a very clear message about how, in some cases it can be helpful, but there's also an important component of consulting with that medical provider and ensuring that that provider is involved every step of the way in understanding the product that they're taking and also making adjustments as needed because it is a medical program. Okay, great. So we're going to go ahead and talk about recommending medical providers. So these are individuals who meet with a patient in a medical clinic and recommend medical cannabis to a patient. And it includes two groups. What we call first is a qualified medical provider, or a QMP. And then there's also a category of recommending medical provider that we call a limited medical provider, an LMP. And then another medical provider that is a core component of our program in Utah is what we call the pharmacy medical provider, or PMP. And this is a pharmacist who works in a medical cannabis pharmacy who consults with the patient about the actual products that they choose to consume. Okay. So let's begin with the qualified medical provider. This is a Utah licensed MD, DO, APRN, PA, or podiatrist. And they must have a controlled substance license issued by DOPL in the state of Utah. And in order to become registered with our office, they must complete at least 4 hours of department-approved education, and during each 2-year renewal cycle, they do that. That renewal cycle is not dependent upon DOPL's renewal cycle for the physician license. There's a separate renewal cycle that the beginning of which begins when the actual provider becomes registered in the state with us. So if a provider got registered today, then their registration would be good for 2 years from today, okay? And then they must register with what's called the Electronic Verification System, or EVS. This is a software that all qualified medical providers are required to use when they recommend medical cannabis to a patient and certify that indeed this patient does have a qualifying condition that is allowed under the state law that qualifies this patient to be eligible to receive medical cannabis recommendations. Okay, and then there's a $100 registration fee and a $50 renewal fee for every 2 years. So that's $100 for initial and then $50 for renewal. So someone from out of state, if they're in Wyoming, yes, a Wyoming MD could do it, but they would have to be licensed here in the state of Utah, and they'd have to physically visit with patients here in Utah. So as you know, there's some physicians and APRNs that are licensed in multiple states. That's okay. It's just when they practice, they'd have to do it here in Utah. Okay. So as I said before, and actually I do need to amend something in here, I realized. So qualified medical providers under the Utah law today, this became effective May 3rd, they may recommend medical cannabis to up to, and actually 930 is the former, that is based on a different number, excuse me. So the actual current number is 1,003. And I say 1,003, and it's changed because of the fact that the limit of the number of medical cannabis recommendations that a qualified medical provider can do is based entirely upon the percentage of the total number of registered medical patient card holders. And on January 1, 2023, that number was 230, but many more medical cannabis card holders have joined the program since that time. So as of the end of March, we got to a limit of 1,003, okay? So as a regulator, we have to adjust that limit based upon the total number of patient card holders every quarter. So right now it's 1,003. And that's 1.5% of the total number of registered medical cannabis patient card holders. Okay? All right. So if a QMP receives payment from a particular patient's insurance plan for services, that patient does not count toward that 1,003 recommendation limit. So when we launched the program, and this also, there still is a number of providers that choose, they can exercise discretion on this, and they choose not to bill insurance. And they have their reasons for that. And but many do choose to bill insurance, and they bill it as, they code it as a treatment of chronic pain or cancer or PTSD, whatever the qualifying condition of the particular patient is, right? Because you code it according to that. And then if the patient mentions that they're interested in a medical cannabis card, the QMP would have the option of recommending that and recommending up to 1,003 patients. Okay. Now, but if that provider bills the patient's insurance, then they are not subject to that 1,003 limit. And there are, I believe there may be some insurance panels that might be concerned if they find out that a physician that they employ is doing medical cannabis recommendations, and medical cannabis is federally illegal. So that is an issue that would be between the physician and the clinic and the insurance panel. So we don't get involved as a state agency in that. That would just be for them to determine. Okay. But as you would expect, that for those patients that aren't billing insurance, or for those providers that aren't billing insurance, they do charge a lot, like any visit would cost if you weren't billing insurance, right? So the cost of medical cannabis evaluations, especially at the beginning of the program, and still we see it can be expensive, and the private market controls what those expenses are, or what those charges are. And there are some clinics that specialize in medical cannabis recommendations that do hundreds of them a week. And at times, you know, they're getting $400 at the beginning of the program. Some were getting $500 and $600 for a visit. And unfortunately, I think some patients fell predatory to that. And one thing we'll talk about a little bit more later that is helping in the program right now is that all providers that are representing to the public that they do medical cannabis recommendations are required to report what they charge as an estimate to us, and we post that on a website that we manage, and so patients can go and find out what other providers or clinics are charging for those visits. And so that's helped in the program to keep the costs down as the clinics are having to be transparent about it. It is medicalcannabis.utah.gov, and there is a link. At the end of the presentation, I'll take you there. Let's do that. Okay. Because it's a very long, as websites are, they have long ends to them, and that's one example of it. Okay, great. And then a QMP, one thing that makes a QMP unique is not only that they are able to recommend up to 1,003 medical cannabis cardholders, but also that they can recommend to patients younger than 21. The others can't, but if you're registered with DHHS, you can if you choose to. And also, a provider may meet with a patient who does not have a qualifying condition, and we'll talk about the list of those. But if by chance, for example, insomnia is not a qualifying condition, although some people with chronic pain don't sleep well. But so, not being able to sleep well could be a symptom of chronic pain or persistent pain. But anyway, if their primary condition is insomnia, they would not have a qualifying condition. But our program makes it so a provider, if they feel strongly that this patient would benefit from medical cannabis or that they should just try it as an alternative, then that provider can help the patient submit what's called a petition to the Compassionate Use Board. This is a board of physicians that all have some expertise in some of the conditions that aren't really qualifying conditions, but we found that sometimes some of those fall in like psychiatric conditions, for example, depression or anxiety are not qualifying conditions, but they can still go before the Compassionate Use Board. The board reviews it, and on occasion they have approved a medical cannabis card, and a patient has gotten a card despite the fact that they don't have a qualifying condition that's listed in the state law. But all those have to go through the Compassionate Use Board.
How many are on the list of qualified?
We'll talk about that. Yep. Okay. Good question. All right, so we already talked about the Compassionate Use Board. This talks about the patients who do not have a qualifying condition for medical cannabis, but if they still want to be considered, they would have to demonstrate that those 3 bullets below apply to them if they're submitting a petition. Okay, so we've talked about the QMPs, registered with Department of Health and Human Services, but we're going to talk now about the limited medical provider requirements. So there are over 21,000 plus MDs, DOs, APRNs, PAs, or podiatrists that exist in the state of Utah that are licensed by DOPL, okay? Any of them can recommend medical cannabis to up to 15 patients, okay? And so if you want to do more than 15, though, you'd have to get registered with our office. But they just have to have a controlled substance license, and doing those recommendations to up to 15 does not require continuing education specific to medical cannabis. Like to get the QMP, you have to have at least 4 hours. And DHHS registration as well is not required. And here's what a QMP would need to do is they are meeting with patients. So there's this requirement of an initial face-to-face appointment with the patient, okay? Interesting, even during the beginning of the COVID-19 pandemic, this law remained the same. It never changed. And so there is that requirement for that face-to-face appointment, at least initially. And then there's the requirement that they make the recommendation in the setting of a provider-patient relationship. So that means that there's a thorough medical assessment, and you see those 5 bullets there that goes through what that should include. So making sure that there's drugs that may be a contraindication for certain types of medical cannabis. Dr. Babbitts will talk about some of those during his presentation. That's one of the requirements of a QMP, that they check for that. Also, that they consider the patient's qualifying condition in light of a potential history of substance use or opiate use disorder, because it's been found that those individuals are just more likely to abuse cannabis. And also, the QMP is required to consider the patient's history of medical cannabis or controlled substance use. So making sure there's the review of the controlled substance database that all providers, prescribers have access to, and just checking that and asking the patient questions about what other drugs they're taking currently. Those are all important. Yes?
On the history of substance abuse and opioid disorder, I have not had one patient come in with a medical cannabis card that wasn't a heavy user before they got that. So what is that considered?
Well, as a provider, I'm not a clinician. Dr. Babbitts, would you make sure you talk about that a little bit? I think that's a fair question, and the question, just for those maybe joining online, is this physician that's here in the audience has had a question about exactly, well, he's just commented that he's never met with a patient that was interested in getting a medical cannabis card that did not have a history of using cannabis in the past where there was some abuse of marijuana, right? In those cases. And so by very fact of them asking for it, maybe there might be some concern from some clinicians or concern felt at least, right? Because in your experience you found that in those cases that's evidence of them having abuse, just the fact that they've used in the past and abused in the past, right? Okay, we'll put a little bookmark on that one. Dr. Babbitts, I think, is more qualified to touch on that than I am. Good question, though. Okay.
Could you comment briefly on what happens? It looks like this population of patients, there might be a number of them who have a prison history. What happens to these patients when they've gotten out of prison, for example, or maybe one of your patients is now in prison? Can they continue with their medical cannabis card in prison? Do we supply the Utah State Prison with medical cannabis?
My understanding is that you'd have to check with the prison. I'm not a representative of the prison, but you'd need to confirm with them directly, but I don't think they do allow it. Right.
So they can just have this severe condition that needs medical cannabis, but if they're in prison, they're out of luck.
I think you need to contact the state prison, just because I don't represent them. They are connected to a sister state agency, but that's a good question, I think, that should be to the state prison. It's a sensitive issue because in state facilities, there's often federal funding involved, right? And if there is a distribution of drugs that are federally illegal, potentially that presents a problem. But you'd have to, I think, contact the authorities there and check on that. Yeah. Okay. Yes?
What is EVS?
That stands for Electronic Verification System, and that is the software that the Department of Health and Human Services requires that a qualified medical provider log into when they're recommending a medical cannabis card to a patient. And so every QMP that participates in our program, the 930 or so that are in the program, they all have a login, username and password with the EVS, and they get access to it, and they have the option to document. Well, they document the assessment in the patient's record and then in their own records, but they can also to communicate that assessment to the pharmacist at the location where this patient is going. They'd be able to record it in the EVS, and then the pharmacist at all the 15 medical cannabis pharmacies have access to that software. So they're able to see the notes from the patient, from the provider that recommended cannabis. That is the one way to communicate information securely to the pharmacist at the medical cannabis pharmacy regarding a particular patient's assessment.
Would you recommend charting in the EVS or no?
I do. Now, one thing I would encourage, though, is that I think in some cases there's clinicians that may go overboard and share too much information, right? And when you talk about disclosure of patient information, you always think about what's the least amount of information that I should disclose. Think about what's relevant for a pharmacist to know about this particular patient. Share that information, but you don't need to upload 30 pages of visit information. Does that sound accurate, Dr. Babbitts?
I upload my initial visit, the first visit.
Right, yeah. Yeah, so I think we get concerned when there's oversharing of information that's not necessary, right? It's important to be concise and relevant so the patient can get assistance, and there's information sharing, but information that is not relevant is not shared. Okay.
What do you do about dose changes, increases?
Right, so there is the ability to add a new, what we call a certification, and to change what you're recommending to the patient in the system. And there's, I think, a whole nother presentation we could do on how to do that. And there's actually information on our website that is a guide as to how to communicate those changes. But there is the ability to modify what you've recommended. There's also the ability to not specify any specifics, but to give that discretion to the pharmacist at the medical cannabis pharmacy. So some physicians choose to do that. They choose to just trust the pharmacist to be able to make that determination, because often pharmacists are really in touch with the products, and if the physician feels very strongly that a particular patient should not have a certain type of medical cannabis, like a vaping device, a vaping cartridge, or a flower, they're able to place those restrictions in the EVS such that a patient would not be able to purchase those. And so there could be those natural specifications that some physicians may have, and they could just leave the rest up to the pharmacist.
This may be too technical, but
Mm-hmm.
those that grow the cannabis for state program, how much variation is there in the kind of plants they're using?
There's a lot of variation in the different types of plants that are used and products. The market drives that variation. There's more variation in other states that have had programs for a lot longer than we have, and that have a lot more facilities where they sell cannabis products. Yeah. But one thing that is unique about our program is that and across the United States, you don't typically see a physician recommending a specific brand of medical cannabis. Drilling it down to the specificity of a prescription, we don't see. What we see is some general guidelines, limits on how much they purchase, limits on ratio of CBD to THC, limits on levels of THC, the psychoactive element in cannabis. And on the dosage types that they can use to the method of delivery.
We have labeling requirements. That's what's on it.
Right, and we have labeling requirements so the patient always knows what's on there. They can also request a certificate of analysis to even go deeper and get more information. And providers can go online and they can see what the inventory looks like, and we're working on adding more specificity to what a provider can learn online about the products available at a particular location. and a patient could learn. Because we've noticed that's a gap, we need to be more specific about that. But yeah, that gives you a little more information on that. Okay. Other questions while we're here? Okay. So, in the past, patients have been able to have a card for 6 months. And that was prior to May 3rd. And then if they had a card for a year, they could get a 1-year renewal. The law changed on May 3rd, and today the default is 1 year, but a provider can contact us and request that a certain patient be issued a card for a shorter period, like 6 months or 3 months. And over the course of the program has matured and made different changes to the duration of the medical cannabis cards and the renewal frequency. And it's been anywhere from 30 days to 90 days to 6 months, and now it's at 1 year unless requested to be shorter by the medical provider.
But that's for the card. What about for the prescription?
A provider could limit the amount of medical cannabis that their patient buys every 30 days. And they would just specify that in the EVS software. Yeah. Okay, so we talked about the limited medical provider a little bit, but to remind everybody, you can choose not to register with the DHHS, but still participate in the cannabis program as a provider. And you do that you can recommend up to 15 medical cannabis card holders, and we will manage that in the software and make sure that that number has not gone over. And then the LMP cannot do recommendations to patients younger than 21 and to patients who do not have a qualifying condition. Okay? And similar requirements that LMPs have applied, but one thing that's different is that fifth bullet, rather than going into the EVS, the limited medical provider, what they do is they go onto our website and they obtain what's called the limited medical provider recommendation for medical cannabis form. And then they submit that form in a secure way to the medical cannabis pharmacy that the patient chooses to go to. So the patient would need to communicate to that provider, hey, this is the one I'm going to. Our website has contact information for all of the pharmacies that are licensed in the state. And so the limited medical provider or the clinic that they work with could send that in a secure way to the pharmacy, and then the pharmacy actually inputs that into the EVS. And so that's how that would work. Okay, and then there's the same renewal period for LMP recommended cards. It's a 1-year renewal cycle unless that provider requests a shorter period. And this is what the LMP recommendation form looks like. And I know that's small, but just basic demographic information about the medical provider and then also the patient, like DOPL license numbers, controlled substance license numbers, DEA number.
Is that an online form or is it typed?
It is not an online form. It is a PDF document that the provider or their staff would print out or type into as a PDF and then print out or save electronically and then email securely to the pharmacy. It's a little bit of a manual process, but it's because they're not registered in our program. Yeah.
Could you give me a reminder, in terms of doing this, you just need to be licensed in the state and have a DEA number.
Uh-huh.
You use this form and you can prescribe to 15 patients.
That's right.
Recommend.
Right. And I'm glad you're pointing that out because the verb prescribe is limited to FDA-approved drugs. and a controlled substance license, right? Yeah.
15 of your own patients.
And, yeah, of course you have to meet with the patient in person. Yeah, that's how that works. good questions. And yeah,
So the QMP doesn't have this form?
no, because they do a higher volume, more than 15, and they are required to set up a username and password with our office and log in and use the EVS or their staff as their proxy in using the EVS system. Okay?
Register, we do all that.
And when you register as a QMP, you set up the password and you would do all of that. And then you're able to recommend to up to the 1003.
And it seems like in years past, there was some kind of a special dispensation given to anesthesiologists. Is that right?
They had a higher limit in the past.
There was like the American Board of Medical Specialties. I think some of you may be certified with them. If you had that, you could recommend up to 600, but that was something that was in place prior to May 3rd. Law changed on May 3rd. Now, all of the QMPs, the 930 that are registered in our program, they can all recommend up to 1003. Yeah. And so that's not just MDs, but it's DOs, it's APRNs, it's PAs, it's podiatrists with controlled substance licenses licensed in the state of Utah by DOPL. Yeah, okay. Great. So if you're interested in learning more about recommending medical cannabis on your own, some of you may subscribe to Utah Physician Magazine. If you don't, you can just go online to this link. And this provides some more detail about the program. The information provided in here, it talks about the former limits in the law. So just be aware that that information, when it talks about limits, that's outdated because there were some new laws that came into place on May 3rd of this year. But it gives some good background information that you may find interesting. Okay. And it looks like I've got about 5 more minutes.
5 minutes ago, 2 questions.
Yeah, and then questions, and we're going to open it up. Okay. But do you have a question?
Well, yeah, I can do it later. But if your primary care physician is not on the list, do you have a list of the ones that are?
Yes. So his question was, if you are a primary care physician and you choose not to recommend medical cannabis as an LMP, and you aren't a QMP, then there is a list of all of those QMPs that can recommend up to the 1003 on our website, and it's public information. Anybody can go on there. The clinic, the contact information is all there, and there's also like a little geographic map that you can go to that will show you geographically all of those in Ogden area or in Davis County area. You can zoom in and zoom out according to geographic location of the patient. Okay? All right, so the pharmacists. We won't spend too much time here, but bottom line is they have to do education as well, and they have a registration fee. And then what does the pharmacist, or we call it a pharmacy medical provider, or a PMP, do? So they review the medical cannabis orders in the EVS for patients. It is their responsibility to make sure that the patient gets the right product. If the physician specified some limitations, then the pharmacist is responsible to ensure that those limitations are complied with, just like a prescription at a neighborhood pharmacy. With FDA-approved drugs, a pharmacist's responsibility is to make sure those patients get the right medication, and it's serious violation if the patient gets the wrong one, obviously, right? So same with this, is that if there are specifications communicated by the provider, pharmacist is responsible to make sure there's a review of the orders to make sure that those are followed, okay? If there are orders, but they're, yeah, go ahead.
There was a box in that previous slide, and it spoke
of the product. That's the state limit of.
Project. Yeah. But then they also spoke of 20 milligrams for
Yeah.
THC. Do they mix them?
Did I don't think we've reached that slide yet. I go back?
I wouldn't know it.
Oh, we'll go into more detail later. This is kind of small, and I'm going to cruise through because that's an important thing to focus on. There are state limits. Yeah. Okay. So let's go. So the pharmacist, they're there to help. The controlled substance database, we've talked about that a little bit, but you as a prescriber, even if you choose not to participate in the program, you can go and you can verify if a particular patient has a valid medical cannabis card. You could confirm if they're one of the 70,000 that do have one in Utah currently, okay? So you look for the little marijuana leaf in the controlled substance database. This just gives you a screenshot of what that looks like, okay? All right, and then there's legal protections under state law for recommending medical providers. Now, it is still against federal law to purchase and possess medical cannabis products that have more than 0.3% or more THC. So, because of that, some providers, especially at the beginning of the program, were concerned that they would be disciplined by the DEA or their federal DEA license would be put in jeopardy because they were recommending medical cannabis under a legal state program. Now, no providers, to my knowledge, have ever been disciplined for that across the United States, but that's just one concern, obviously. So what lawmakers did is they put together some general protections that relate to state laws, not federal, but state laws, and this just summarizes those. There's 16 qualifying conditions for medical cannabis use, and sometimes there's new ones that are approved by the legislature, and patients with non-qualifying conditions can be petitioned to the Cannabis Research Review Board. It's 3:20. I've got till 3:30, but I'm going to just go over some items really quick. We've covered a lot of questions during the presentation. I want to make sure we cover anything that relates to these additional slides. So we've got the qualifying conditions list. As I said, there's 16. The most common by far, no surprise, qualifying condition is that of what we call persistent pain, and that is, let's see here, that is summarized here in this bullet. Pain lasting longer than 2 weeks that is not adequately managed by conventional medications besides opiates or opiates or physical interventions, okay? So the provider is determining, hey, these things have been tried already and it's not working. So we are resorting to having this patient try an alternative under the state law. Okay, so go ahead. Was there a question? Yeah, sorry, I've gone through this quick. PTSD is the only psychological or mental health condition in the list, and it has some very specific factors attached to it that must be in place, and those are summarized there. Okay. And then cancer. And about 75% of the 70,000 that participate in our program are listed in our software as having the persistent pain as their qualifying condition. I think second to that is cancer, and then PTSD, and then all of these appear at very small numbers: epilepsy, Crohn's.
So, cancer is a broad topic.
Mm-hmm.
I mean, I can have a basal cell on my face, and that wouldn't qualify me for medical cannabis. Does it mean cancer pain, or what is cancer?
I think that's up to physicians to exercise discretion on. Dr. Babbitts?
Pain, weight loss, nausea, anorexia, those are conditions with cancer that are amenable to treatment with cannabis. So
Right. Yep. He's got some good examples that he just named off. Yeah. Okay. Great. Okay. So we got the Cannabis Research Review Board. This is a board of medical researchers and physicians who evaluate the literature, the studies that are out there. Now, in the United States, there's not the volume of studies available as there is in like Canada or Israel, but there are some studies, and we still consider those studies from Israel and Canada and other countries. But the bottom line is that the legislature has this directive to summarize the literature out there and make some suggested use guidelines for providers. So we have those on our website. Those are available at that link. And there's a list of the qualifying conditions. And click on that link, and there's a summary of the literature that relates to that specific condition. Now, I will acknowledge that there are some conditions that are on the qualified condition list that don't have a lot of scientific rigor and a lot of evidence. And the board makes that clear, is that with this particular condition, they'll say there's little evidence that this is an effective treatment, that cannabis is an effective treatment for this condition. But lawmakers consider more factors than scientific literature in decisions they make, as I think we all know. There's political factors, there's economic factors, and so those are some of the ways that some of those other conditions got on there. Anyway. Okay, dosing guidelines, that's some information that a provider could include in the software, so they can indicate the dosage form, dosage amount, and those are optional. But if the recommending medical provider does not include them, the P&P or the pharmacist will determine them. So that model, I know, is very different than the FDA-approved drug model, right? But that is the model for Utah's medical cannabis program. Here's a list of the legal dosage forms in Utah. And we don't sell a lot of tablets in the state, but that is legal. Capsules, there's not a high number of those. What we see more of are gelatinous cubes or gummies, or it has to be in the shape of a cube. It can't be in the shape of a circle or a gummy bear. It must be in the shape of a cube or a lozenge. Okay, and then we've got liquid suspensions. Those are obviously oral. We got flour, which is, I'd say with unprocessed flour, the concentrated oils with a vape cartridge, and the gummies or gelatinous cubes, those are the most popular dosage types in Utah. And then there's wax, resin, there's sublingual preparations, there's topical preparations like a lotion or a cream, okay? One thing also that is important about Utah's law is that smoking or combustion is illegal, but everybody knows reality is that a high number of people do smoke it anyway, illegally. But under the cannabis program, you can purchase flour and you can buy a grinder and grind it, and then you can vaporize it, and you can consume it legally with a vaporizer device that a patient would purchase.
So none of those are meant to be smoked, just vaporized. It's illegal if they smoke.
That is true, right. Now, reality is different. We all know combustion and smoking of cannabis goes, and people buy from the pharmacies every day, and I'm sure they go home and smoke it. But under state law, that is illegal. Okay. This is what 113 grams looks like. If someone were to buy it of the flour product, that's what it looks like. In a very crude way. That's how big it might look. But that's the limit. And that is actually a lot of product, 113 grams, 4 ounces. Now, so that is the limit for every 28-day period. So a cardholder may purchase no more than an amount to provide 30 days of treatment based on the dosing guidelines and the medical cannabis recommendations. So if the QMP specifies limits, the patient is always limited by those limits, similar to a prescription, right? But not exactly like one, because providers don't specify, brands and things, right, of cannabis. They would put some general parameters on it, okay? And then, if there's no dosing guidelines communicated by the QMP, then the limits are the absolute, you can't go over the limit. Limits are 113 grams by weight of unprocessed flour, which looks kind of like that. And then there's flour, and then there's everything else, okay? So everything else, concentrates, gummies, vaping cartridges, lotions, the only limit on those is 20 grams of composite of THC in all other dosage types, okay? All right, so, and then all cannabis must be purchased from a Utah medical cannabis pharmacy. So it's illegal for someone to go to Nevada, buy it there, bring it across state lines, and possess it here in the state of Utah.
Is there a way to differentiate? I'm looking at that picture. Is there a way I can know that's from Utah?
So under state law, the patient, when they buy it, they are required to maintain the packaging, and there's a unique identifying number that law enforcement might use to track it. And if there's no evidence of being able to track it, then that patient is in violation of state law, and there's no evidence that it was legally purchased. Yeah.
I think it's the state of Oregon has the legal right to be able to have psilocybin for their population.
Uh-huh.
They need it, and which speaks for expanding areas of problems.
Mm-hmm.
Or could be.
Right. So he brought up psilocybin, psychedelics, and there was a bill that was attempted and filed, but it did not pass during the last legislative session that would have set up a program for that. But one of the reasons why it failed, I believe, is because the FDA has already got fast-tracked some versions of psilocybin that would be legal under federal law if they got approved. Right. Great. Okay. So medical cannabis pharmacies, this is just talking about the standards. Here's where the locations are throughout the state. 15 locations. And we've covered a lot of questions. Here's our contact information and our phone number. And thanks for being engaged and listening in. And you're welcome to contact us later with more questions. And now I'll turn it over to Dr. Babbitts, and he'll talk about